In the past 5 weeks, the number of treatment beds has increased from less than 10 to over 500 in 19 health centers. With support from WHO and the Africa CDC, laboratory capacity has increased from 30 tests a day at the central laboratory in Kinshasa to over 2,000 tests a day in 9 labs across 3 provinces. More communities are becoming aware of the risks of Ebola and asking for the tools and support to protect themselves. And more than 100 people have now recovered. With early detection and supportive care, many can survive this disease. But we could save many more lives with therapeutics, and preparations are now complete for a trial of 2 therapeutics that's expected to start in DRC next week. The trial will evaluate whether 2 antivirals, MBP134 and remdesivir, can help to reduce mortality in patients with Bundibugyo virus disease, alone or in combination. We thank the United States and Gilead Sciences for donating those of the trial. Together with our partners, we will announce more information next week. WHO and our partners are working closely with the communities to inform and involve them in the trial. We're also working to ensure the communities have access to the therapeutics should they prove safe and efficacious. The trial will be conducted by a consortium of partners, including DRC's National Institute for Biomedical Research, ALIMA, Oxford University, and WHO. Despite the good progress we have made, we still face major challenges, and the outbreak is continuing to outpace the response. There are now 1,094 confirmed cases with 277 deaths. The outbreak is continuing to move fast. Political advocacy and action are essential to create the conditions for increased humanitarian access and a scaled response, because the outbreak is happening in a complex situation. In neighboring Uganda, a new case was reported last Sunday, the first in 2 weeks. This brings the total in Uganda to 20 confirmed cases with 2 confirmed deaths. All cases in Uganda are linked to the outbreak in DRC. Today, France reported that a health worker with the NGO Alima, who returned to the country after caring for an Ebola patient in DRC, tested positive for the virus and is now being monitored and receiving care. This case is a reminder of the risks faced by frontline responders. Almost 80 health workers have been infected, highlighting the risks they face and the importance of strengthening infection prevention and control. WHO advises countries to support the safe deployment of personnel responding to this outbreak. This includes ensuring that organizations deploying staff provide clear information on risks, how to reduce and manage the risks of exposure, and that countries are prepared to facilitate evacuation if needed. Still, the risk to the rest of the world remains low. Under the government's leadership, the coordinated response to the outbreak is starting to take hold, but continued scale-up is needed. Contact tracing is still not at the level needed. Capacity at treatment and isolation centers is insufficient. Safe and dignified burials remain a major challenge. The health system is under pressure. Border closures continue to hinder the response. Multiple security incidents have been reported, and the affected area is in the grip of a decades-long humanitarian crisis, and financial support is still insufficient. Earlier this month, WHO and the Africa CDC announced a joint continental preparedness and response plan that reflects the funding needs of partners with an ask of $518 million. Next week, the first financial reporting on pledges and commitment to the plan are expected to be available, providing a clear understanding of gaps and needs.